Assalamu alaikum. Today we will discuss about stress urinary incontinence. Stress urinary incontinence, it is very common among ladies and it is defined as involuntary loss of urine on physical exertion. That means the patient is unable to control the urine during some activities or when they cough, sneeze or any activities which gives more stress, more pressure in the abdomen. For them, they cannot control the urine. The common cause for this problem is, you see, it is very common among obese and those who had multiple deliveries, and especially diabetes. These patients are more prone for stress urinary incontinence. There are two main mechanisms. One is weakness of their sphincter mechanism. That means their sphincter which controls the urine, that muscle is weak. The second thing, the supportive structure, the structures which supports the urine passing tube, that get weakens. So the stress urinary incontinence, it causes a lot of psychological anxiety and social problems, and that affect their routine activities. So the patient with stress urinary incontinence, they need a proper evaluation for the what is the cause for it, and they need a proper treatment for that. In general, there are a lot of general measures to reduce the incidence of stress urinary incontinence, especially the patient who are obese. They should reduce the weight, and as I told you, it is very common among ladies after multiple delivery. So after delivery, it is preferable to have a pelvic muscle training exercise, and other options like they can control the water intake, and they should void before any strenuous activity. If they are going for any strenuous activity which anticipate an incontinence, preferably they should void before. There are a lot of treatment options for this stress urinary incontinence, like medical treatment and lot of various surgical options. Nowadays we are having a lot of surgery which are very minimally invasive. That is, patient is having only one day admission and less stress in the hospital. Within one day they can be discharged, and the common surgeries are, we say, mid-urethral sling. That is a special net we place below the weak part of the urethra, so that will support the urethra, that means urine passing tube, and that will help the patient to be continent. That is, they can hold the urine even after any stress or any physical activity. They will not feel the urinary incontinence. So those who are suffering from this stress urinary incontinence, and don't think that it is normal for your life, because many will consider that it is okay for their life based on their age, and they will try to adjust with that. So try to solve the problem by consulting to the doctor and get your treatment done at the earliest, so that the quality of your life, inshallah, will be improved.